Good afternoon and good evening to all of you joining us around the world today. This is the press briefing that we are hosting here at the WHO Regional Office for Europe. I'm joined by our Regional Director, Dr. Hans Kluger. I'm also joined by Catherine Smallwood, Incident Manager with the Emergencies team here at WHO Europe. Thank you very much for the media joining us today online via Zoom. Looking forward to you raising your hands for any questions. I've also received questions in advance from journalists that I will come to shortly. So thank you again for joining us. With that, I'm going to go over to the Regional Director to make an opening remark. Thank you.
Good morning, everyone. We do have a very serious situation unfolding before us. Weekly cases have now exceeded those reported when the pandemic first peaked in Europe in March. Last week, the region's weekly tally exceeded 300,000 patients. More than half of European countries have reported a greater than 10% increase in cases in the past 2 weeks. Of those, 7 countries have seen newly reported cases increase more than twofold in the same period. In the spring and early summer, we were able to see the impact of strict lockdown measures. Our efforts, our sacrifices paid off. In June, cases hit an all-time low. The September case numbers, however, should serve as a wake-up call for all of us. Although these numbers reflect more comprehensive testing, it also shows alarming rates of transmission across the region. While we did see an increase in cases among older age groups, 50 to 64 and 65 to 79 years in the first week of September, the biggest proportion is still among 25 to 49-year-olds. This pandemic has taken so much from us. In Europe, 4,893,614 cases of COVID-19 have been recorded and 226,524 deaths. And this tells only part of the story. The impact of our mental health, economies, livelihoods and society has been monumental. The first of my key messages today is a call for regional coherence, an amplified collective effort by all European member states for the sake of all European member states. The response to the crisis has been very effective whenever the actions were prompt and resolute. But the virus has shown merciless whenever partisanship and disinformation prevailed. Where the pandemic goes from here is in our hands. We have fought it back before and we can fight it back again. On Monday this week, at the WHO Regional Office for Europe's Regional Committee meeting, the 53 member states of the European region unanimously adopted a new vision for health for the next 5 years. The European Programme of Work focuses on meeting the needs and expectations of European citizens. With this endorsement, countries articulated the importance of solidarity and trust between our countries. I do believe there is a willingness to live by this ethos as it will protect all our communities. We will continue to advocate with government institutions for policy decisions that are prompted by an actual change in the situation and driven by epidemiological data. This capacity was well demonstrated as countries across the region gradually reopened the schools. A great example of such coherence was the school conference we co-hosted with the Italian Minister of Health, Roberto Speranza, in August, which led to the consensus publication of schooling during the COVID-19 pandemic, which is now available at our website. My second message is that we need to use the knowledge and know-how that we now possess to implement what works and not implement what doesn't. We know we need hospital and intensive care unit capacity, personal protective equipment, but also much greater involvement of the primary and community care. We know we need to protect our health workers and other frontline workers who keep society running, and the elderly in long-term care homes. We know the basic public health measures which work, including scaling up of testing, hand washing, physical distancing, masks when physical distancing is not possible, and avoiding large gatherings. But we also need to be restless to update scientific knowledge as more evidence becomes available. Take, for example, quarantine as a cornerstone of our fight against COVID-19. The 14 days quarantine period is a conservative estimate of the infectious period, which, despite some remaining uncertainty, covers 3 to 5 days before and 5 days after the symptoms. Knowing the immense individual and societal impact, even a slight reduction in the length of quarantine can have, and giving the figures I have just mentioned, I encourage countries of the region to make scientific due process with their experts and explore safe reduction options. The concept of quarantine must be protected, continuously adapted, clarified and well communicated without any ambiguity to the people. I am offering the WHO region convening power to ensure that such discussions take place coherently and in a coordinated manner among member states, and then jointly communicated to the people of Europe. Their adherence to quarantine is at the end what will define it and determine its purpose. Despite continued high adherence and support to pandemic response strategies in populations across the region, member states are reporting and documenting COVID-related fatigue in their populations. My third message is that we need to understand people's concerns. We need to empathize with the fatigue that is setting in. Fatigue is an expected and natural response to a long-standing public health crisis, which for everyone has had considerable implications for everyday life. Understanding who is experiencing fatigue and the barriers and drivers they experience in taking up protection behaviors allows to segment and tailor actions to those that need it the most and based on the needs of specific population groups. This requires more successful and cost-effective policies, intervention and communication. It requires that we embrace disciplines outside of the biomedical sphere, such as social sciences and the humanities. There are 4 key strategies WHO promotes here to counteract fatigue. First, collect and use evidence for targeted, tailored interventions. WHO Europe has been working with 27 countries to conduct behavioral insights surveys. Second, find ways to engage individuals and communities at every local level. For example, in Denmark, the Facebook page True Story involved influencers with video diaries of being young and on their own. It has reached 4 million people. Third, focus on reducing harm, where and when possible, rather than closing down. Engage the youth in finding new and safe ways to be social. And 4, acknowledge hardship. Communicate hope and empathy. For particular subgroups or age groups, such as youth, for example, this means we make an effort to understand the barriers they face. We engage them, acknowledge the hardship and empathize, and make them part of the solution. we move from do not to do differently, finding newer and safer ways to be social and avoid loneliness. The WHO Regional Office for Europe is developing a framework to help authorities, national and local, plan and implement national and subnational strategies to counter fatigue and reignite public support for recommendations and COVID-19 preventive behaviors. So to repeat my 3 messages. 1. Regional coherence and the spirit of collective support is crucial. 2. The knowledge and know-how we possess has to be put to best use. And 3. Fatigue is natural. It needs to be understood and addressed where it puts us at risk. I'd like to close by expressing our support to the European Union President, Ursula von der Leyen. Yesterday, Dr. von der Leyen delivered her State of the Union to the European Parliament. Advocating to revitalize multilateralism, she called for a WHO that is fit for purpose and commended our joint efforts. We do share her vision for a European Health Union. With the Commissioner for Health and Food Safety, Dr. Stella Kyriakidis, we adopted a joint statement at the Regional Committee last Monday, going into a historical partnership between the European Commission and the WHO Regional Office for Europe for the benefit of the Member States and people both our organizations serve. President von der Leyen referred to the unshakable belief in the hidden strength of the human spirit, which I believe has been at the very heart of our response. We need to draw on that spirit again in order to take a collective leap forward towards a brighter future for our society. Thank you.
Thank you very much, Regional Director, for that statement. I'm going to go straight to a question we've received in advance, and this is for you, Katie, I think, regarding, and the question reads, should teachers and pupils wear face masks in classrooms during classes? So the Regional Director referred to the opening of schools. That is from the Czech news agency, from Eliska Negeliova, from CTK. So Katie, please.
Thank you very much for the question, and thank you, Rob. Indeed, in the Czech Republic, we've seen quite a rapid increase in cases since early September, and this coincides with the return to school. So I can very well understand the concern that both health authorities, teachers, and also people returning to school have, that they do so in a safe way. When it comes to deciding on the use of face masks, it needs to be considered very much in this bigger picture, and a very specific assessment needs to take into account the local epidemiologic situation, whether widespread community transmission is occurring, but also what are the other efforts and possibilities that can mean returning to school is safe and possible. And that needs to include, in addition to face masks, it needs to include physical distancing, possible use of increased ventilation to classrooms, compliance with all of these different measures, cultural appropriateness and acceptability. And then when it comes to the face mask particularly, WHO has recommendations that have been issued last week for the specific measures or considerations to be made when measures are applied, and we would not recommend face masks for children that are less than 5. For children that are between the ages of 6 and 11, that needs to very much depend on the level of risk that's anticipated. And then for adolescents, i.e. children that are over than 12, this should be discussed in the same context as those for adults, and that would include teachers. And in that respect, it's very much associated with all of these other measures that are in place and available, and needs to be taken in the same context as local recommendations made by public health authorities. Thank you very much.
Thank you very much, Katie. Next, I'm going to go over to Michael Birnbaum at the Washington Post. Michael, can you hear us? Great.
Yeah. Thank you. So I have a question. The Brussels bureau chief of the Washington Post. I'm wondering, so a number of European countries, including Spain and France, that had the virus under good control earlier this summer, June, July, they now have cases, the levels of new cases that are above those of the United States, adjusted for population. And the US, of course, has never really gotten the virus under full control, unlike Spain, France, and others. I'm wondering, what is the lesson here? Do you think Spain and France, some of these other European countries, have made policy mistakes in their reopening? Or is this kind of quick increase unavoidable right now in the pandemic? Thank you.
Cool. Thanks very much for that question. I'll send that question over to our regional director, Dr. Hans Kluge.
Right, Michael. In fact, we have been alerting for this since the very beginning. What we saw is that the cases decreased not due to a natural course, but because of the strict public health measures. So if you lift the pressure from the virus, naturally you're going to see this increases. So it's definitely not, I would say on the contrary, those countries have been, within the context, doing very well, I would say. And you have to look now that in many cases it's possible to contain those spikes locally. But again, it's quite early to take any, let's say, conclusive measures. And you see in many countries that locally some schools have to be closed down, but not on a national scale. So in that sense, I would hope that national lockdowns can be avoided as much as possible, but conservatively, it's a legitimate question that we have to follow the situation closely. Thank you.
Would you like to add to that, Katie?
Thank you, Rob. Michael, yes, indeed. And I would also note that those European countries that you highlight are very much at a different phase in the pandemic than the US. The US is still very much controlling that first major peak. And I think there are lessons that go from Europe into the other direction as well. And as outlined by our regional director, this comes back to how to open safely and how to reopen economies, how to allow travel to occur. And what we are seeing now in Western Europe particularly is a conflation of factors that are leading to increased transmission in the population. And there's still a lot to learn from that, but also a lot to do to ensure that this increase does not lead to what we saw back in April and March.
Thanks very much, Katie, and thank you, Michael, for the question. Next, I'm going to go over to Lars Henrik Aagaard, who's a journalist at Berlingske newspaper here in Copenhagen. I think this is a question for you, Regional Director, if I could. Nearly all European countries currently register a sharp rise in confirmed cases of COVID-19, but the number of deaths attributed to this disease lag far behind compared to the situation in spring. Is this a cause for hope? Or do you expect to see a similar sharp rise in deaths in the coming weeks? Regional Director, please.
Thank you, Lars Hendrik. I would say both. In fact, this trend we have been seeing already from, let's say, July, mid-July onwards. And we see that in the younger age cohorts are now more and more infections being diagnosed, which doesn't mean that it's more in youth. There are several reasons. For example, that we know much better how to protect the elderly population, which is a very good fact. That testing capacity has been drastically increased. And of course, there's also this time lag, right, of a couple of weeks between increase in cases and hospital admissions and to the intensive care unit. So I would say it's a hopeful message in that sense, that there is still time to act, but it's also a concern. You're absolutely right, particularly as there is a seasonality factor. We know, for example, there is a traditional excess mortality in the elderly people going towards the winter. The influenza season is there, also other respiratory diseases like pneumococcus. And then we talked already about the reopening of the schools and the academic year. So it's a hopeful message, but at the same time, we have to be very, very vigilant. Thank you.
Thank you very much. And next, I'm going to go over to Gunilla von Hall, who's from Svenska Dagbladet. Good morning. Good afternoon, Gunilla. Sorry, good morning. Correct myself. Sorry, I'm getting myself in the wrong time zone here. Gunilla, welcome back.
Thank you. Good morning, or almost good afternoon. I have a question. As you said, it's increasing in many European countries, Spain, France, Italy, but it is not increasing the cases so much in Sweden. To what extent do you think this is linked to the fact that Sweden did not have a strict lockdown? People were more exposed. And what lessons could be learned from this to avoid new lockdowns in the rest of Europe? Thank you.
T, could I give that question to you, please? Thank you.
Thank you, Gunilla, for the question. And indeed, if we look at the epidemic curve in Sweden, since July, there's been a relatively stable new incidence in cases that has been lower than what was previously seen in Sweden. We do know that per population, Sweden still cumulatively still has a high total incidence for COVID-19 compared to other countries in the European region. But on the other hand, what we also know is that the seroprevalence, based on some of the studies that have come out, is not that significantly different to other countries. That means in Sweden, it's still our assessment that there are a large proportion of the population that remains susceptible to COVID-19. However, we must recognize that Sweden has seen at the moment has avoided the increase that has been seen in some of the other countries. It's not alone in that, but certainly it's a really positive trend that cases are not rising in Sweden as they are in other countries in Western Europe particularly. And I think there are lessons for that. We'd be very keen on working and hearing more from the Swedish approach, particularly in the aspects of its sustainability, continued engagement by local populations in some of the measures. And those lessons, of course, can be shared with other countries, both within Europe but also beyond. Thank you.
Thank you very much, Katie. We've got a follow-up question from CTK, from Aliska. Katie, and this is also for you, if I can keep you on the hotspot. Does the WHO have any recommendations for testing during the autumn and winter months when the flu becomes more prevalent? Should everyone with symptoms get tested, or only people who are in contact with a COVID-positive individual?
Thank you, Rob. And indeed, when the influenza season, which happens every year, appears, this may add complications to the way we respond to COVID-19. Our key messages here are that routine sentinel surveillance systems for influenza continue to pick up influenza cases as well as COVID-19 cases. And that is important, because it's very important that although we may not see the two viruses circulating with the same intensity, that we're able to pick those up, but that the laboratory systems are optimized so that they can really scan for both viruses and manage the caseloads that will come from both viruses. When it comes to community testing, we very much recommend that patients that have COVID-like symptoms seek COVID tests. There should be no change in that approach. It's very important that people continue to seek testing for COVID-19 and that we continue to understand where the virus is and how it's spreading among our communities.
Thank you very much, Katie. Okay, we go over to Jamie Keaton from Associated Press. Welcome back, Jamie. Please go ahead.
Hi, can you hear me?
Please go ahead. Thanks.
Great, fantastic. Thank you very much for taking my call. Dr. Kluge, which countries have reduced their quarantines down, and which ones are you specifically worried about? Are you worried, for example, that France cut its quarantine and that there are other countries that have reduced their quarantine times?
Thank you, Jamie. So I am concerned about all 53 European member states, because as I told the 53 ministers when I shared at the Regional Committee last week, Monday, the lessons learned from the COVID-19 so far, no one is safe until everyone is safe. And if there is a second wave, some countries, in fact we see it already, which were doing far better in the first wave, are being hit much worse. But today in September, Jamie, is not yesterday in February. We have a lot of more know-how on the hospitals, the ICU, the primary healthcare, how people behavior has improved, despite of some resistance in some smaller groups, and then also involve the behavioral scientists. So overall, it's a worrying situation, but we have to be hopeful. We have been able to push it back the first time, and we know much better. At the same time, of course, we continue through WHO globally to give a good push at the so-called COVAX facility for the development of a safe and effective vaccine coordination, which will not be the end of the pandemic. As I always say, the end of the pandemic will be when, as a community, we learn how to behave, whether it is with the COVID-19 or another virus.
Could I follow up?
Thanks. Yeah, I was just going to go to Katie first, Jamie, before your follow-up question, if I may. Katie, would you like to add anything on that point?
Sure. I would add that, as the regional director noted, our quarantine recommendations of 14 days have been based on our understanding of the incubation period and transmission of the disease. And we would only revise that on a basis of a change in our understanding of the science. That's so far not the case. Several countries are considering changes, and it's in this context that we would really re-emphasize that our position is that a 14-day quarantine is important for patients that have been exposed to the virus, and that's based on our guidelines for contact tracing and identification and exposure of people who have been potentially exposed to confirmed COVID-19 cases. Over.
You had a follow-up question. Go ahead.
Yes, I did. Thank you very much. This all plays in, of course, to the whole issue of mixed messages that we're getting from various governments. And there were some mixed messages coming from the United States last night about vaccines, on mask wearing, etc. But I want to ask you a quick mixed message question. You folks are wearing masks today. We had a briefing by WHO headquarters this morning where they were not wearing masks, and they're located in between France and Switzerland, which are both experiencing a rise in cases. What has brought you to wear masks today while they are not? Thank you.
Please, Regional Director.
Thank you, Jamie. So the recommendation is overall the same, right? That if you cannot guarantee the physical distancing, that masks definitely are recommended. This is number one. Number two, it is a clear signal that we are going into a worsening situation. So there is no reason for panic, but particularly at the moment that we see a fatigue and a resistance in behavior that is helpful, it's very important to give a signal. And thirdly, it's a strong sign of solidarity, and I have expressed this in my opening speech to the 53 ministers. For example, our president of the Region Committee was Dr. Alexei Vladimirovich Tsoi, the Minister of Health of Kazakhstan, who throughout was presiding the Region Committee from distance in Kazakhstan with the mask throughout. So solidarity is the way forward, and we're standing together with all those countries where the public health measures have to be implemented very, very strict. Thank you.
Katie, would you like to add anything to that response? No. Thank you. Thank you very much, Jamie, for those questions. I have a follow-up question also, Katie, for you, which regards Czech authorities having announced that individuals who came into contact with somebody who has COVID-19 will no longer have to quarantine, provided that both the infected person and the contact wore face masks. Is this measure safe based on scientific evidence?
Thank you for the question, and I think partly it was answered in our response to the previous question around quarantine. But I would highlight that contact tracing remains and is one of the cornerstones of our response to COVID-19. It involves a number of different steps, and these really need to be taken in the context of a appropriate emergency public health measure that involves assessments made by public health experts. One of the steps is a clear exposure assessment that takes place for every contact of a known confirmed COVID-19 case. Based on that exposure assessment, public health officials will be able to decide whether people who have been in contact with confirmed cases may be required to quarantine. And if that quarantine is recommended, WHO's recommendations to all member states is that that would be 14 days from the most recent exposure to a confirmed COVID-19 case.
Thank you very much, Katie. So I see no other hands raised in Zoom, so I thank you very much for today. Thank you very much for joining us. I'd like to close this press briefing at that point and to ask you all to take care and stay very healthy until next time. Thank you.